8:45 right now. As we work to rebound, a new study shows that Florida dentists are kind of worried that a lot of us are going to have post-pandemic dental problems because so many people are skipping their yearly checkups and maybe just not taking care of their teeth as well as they should be. So I'm joined this morning by a friend of mine, Dr. Phil Craver. He's from Cape Dental Care. Good morning, Dr. Phil. How you doing?
Good morning. Thanks for having me, Amy.
Yeah, so happy to have you. So let's talk about this. I hear from a lot of people who, I have more cavities or I might be eating more sweets. So have you seen a breakdown in people's routines and maybe coming to the dentist?
We actually have. Unfortunately, during this pandemic, we've seen people put off routine or preventative dental care that would otherwise prevent a major problem from happening. People are really coming in only when something catastrophic happens or when pain happens.
So I think a reason maybe for that is a lot of people, we read this study that said they're worried about, COVID. And so that's why they're saying, I'm just going to stay home unless it's a dire situation. But what would you say to people? I'm sure you guys are taking steps to keep them safe.
Yes, COVID is a real thing. And luckily in dental offices for decades, we've always practiced universal precautions, meaning that we always treat every patient as if they are infectious with the highest degree of pathogen. And so during COVID, we've just really maintained and upped our systems that have always been very safe for patients. You may see new protocols as you come in, obviously, as you do in most businesses. In dentist office, you'll see like mouth rinses or some maybe aerosol evacuation systems. Also, you may not have a waiting room, so you don't have to sit next to people. But there are a lot of methods that we do as dentists in each office to make sure that patients are safe.
For sure. All right. So if some of our friends at home are watching this and they're thinking, you know what, I'm really off track here, and they're not going to the dentist anytime soon, how can you get back on track? And what are some tips you have? Because obviously you're the expert.
Well, obviously, the first thing to do is just make sure that you're maintaining your own hygiene at home. The most important thing is that you brush your gum line twice daily, but then also that you come in and have your gums checked by your hygienist and your teeth checked by the dentist. Gingivitis, which starts very small in small areas, can turn to gum disease and over time turns to tooth loss. A lot of people aren't aware that little problems over time create these large problems that we can usually solve in a timely manner if taken care of.
Okay, so and obviously flossing is very important. I feel like I need to floss more often than I do. Yeah. How important is it? Is it as important as we always stress?
It really is, and not to be gross, but every time you floss, you do get a lot of stuff out of there. I'm sure you do. And imagine all the times you forget to floss, you leave that in place. And over time, it's a slow process. A lot of times it's not painful, but it does cause tooth decay and gum disease.
This is why you're the dentist and I'm not. But thank you so much for breaking that down for us. Dr. Phil Craver with Cape Dental Care. Go back to your patients, hard at work, and thank you for all you do.
Thank you, Amy. Anytime.
All right. Thank you. All right, Lauren, do you floss a lot? I mean, it is important. I do floss. I just want to say, not to gross out our friends at home, I floss, but I'm not flossing twice a day. It's just
every day. I keep floss in the dressing room. If you ever want to borrow any, I love to floss.
I do too. It's very, I don't know, cathartic in some way, right?
TMI, I floss in the shower. Don't know why, but I have no idea. But that's, to me, it's just like getting everything clean.
Multitasking at its finest. You're going to be a good mom one day.